she is not just a psychologist, she is also a shoemaker. She was trained as a medical doctor, but now she makes beads too. He studied law, and now he is a fashion designer. This one has gotten a new skill: makeover. He came into this camp a biologist. Now he is also a caterer. Saeed, skill acquisition and entrepreneurship development, helps you discover a new lease of life. What are you still waiting for? Get up and acquire a new skill now.
Good day, dear viewer, and welcome yet again to another episode of the My Health and I show. I hope you're doing very well. I hope you're doing good. And if you are a new viewer, you are very, very welcome. We're pleased to have you here. And on this show, what we do is that we discuss everything health, wellness, lifestyle, and well-being. And today, it is nothing different from what we've been doing in other episodes. We're bringing you yet another interesting topic that would not only entertain you, but would enlighten you, as is our standard here. All right, so today we're going to be discussing the topic Superbugs, the hidden threat of antimicrobial resistance. But I did not forget to introduce myself. I'm your host, Emmanuella, as usual, and I'm not alone here today. I'm here with our wonderful guest. I'm going to read her bio very briefly before she goes ahead to introduce herself to us, all right? So I'm here with Dr. Praise Akobo, and Dr. Praise has had over 5 years of experience in social services, leveraging education to promote holistic health. Dr. Praise is a veterinary doctor. She's a policy enthusiast and One Health and Welfare advocate who supports health interventions in IDPs and underserved areas and researches, especially on neglected tropical diseases, antimicrobial resistance, which thankfully is our topic today, and in climate health. She's also undergoing her 1-year National Youth Service Corps program, and she ensures food safety, meat inspection, and hygiene practices, and she makes sure that those practices are kept through her PPA, primary place of assignment. She also serves as the teams and programs lead at Dogalove Human Support Initiative, the only organization in Nigeria pioneering therapeutic and social applications of human-animal interactions across parts of Africa. So you can see that her bio is very long, very knowledgeable, and that is just to tell you the kind of caliber of guest we have here with us today. Good morning, Dr. Praise. We're happy to have you here on the My Health and I show. Before we jump right in, I just want to ask, how are you feeling today?
Okay, so I'm good.
You're good?
So I would say that, of course, I'm very much okay.
Very okay, very good. I'm happy that you're good. And it is very interesting that you are an advocate for antimicrobial resistance, and that's why you had to be the best person to speak to us about this topic today. So yet again, we're very glad to have you, pleased to have you here with us, and we'll jump right into the program, all right? So like I mentioned, as you can see on your screen, the topic for today is superbugs, the hidden threat of antimicrobial resistance. And now I know from the way it sounds, it might seem as though the topic is something very technical, but don't be scared. We'll break it down to you, simplify it in ways that you would digest easily. All right, so starting off the bat, what is antimicrobial resistance? Somebody watching this might be saying, I don't understand. Break it down to us. What is antimicrobial resistance?
Okay, so above every other thing, I'm also a children teacher, so
Ooh.
I will try to really bring it
Nice.
to the barest.
So our guest wears many hats. We're very happy to have you.
Okay, so antimicrobial resistance. So of course, course, anything against, right? Microbial resistance. So merging the words together now. So antimicrobial resistance, first of all, let's look at the first term, antimicrobial, right? So microbials, or when we talk about anything antimicrobials, we're referring to agents. Yeah, so, but the word microbials, let's bring it down to looking at microorganisms, right? So,
yeah.
and these microorganisms, they could be bacteria, of course, viruses, fungi, parasites, right? So when these microorganisms, when they evolve, right, and now begin to now fight against normally what should have fought. Yeah, so let's bring it down again. So for instance, let's say you have like an infection, let's say just like a cut or something, right? And normally most times people just say that, oh, with the way the surface is opened, of course there might be some sort of infection and all of that. So normally if you're given one aspect of the antimicrobials we've talked about, so let's say antibiotics for bacteria, right? If you're giving that, normally that's antibiotic ought to help kill, right,
the bacteria.
Yes, the bacteria. But then it now gets to a point where instead of killing that bacteria, it evolves and now begins to resist what it would have done.
Wow.
So instead of killing, it now becomes resistant. So of course it stops the effect. So it's not killing, it's not stopping, the wound is not healing, and of course the bacteria becomes resistant. So you're not getting better. And that's what it means basically.
Amazing. So in very, very simple terms, Dr. Praise has told us what antimicrobial resistance is. So it is when the thing that is supposed to be an assassin, okay, I'm going to use a very similar example, Actor and Bose, right? I think Bose is the good guy. Who is the good guy? Actor
is the good guy.
Actor is the good guy. So the actor is supposed to be the drug, the Bose is the microorganism. In this case, the example she cited, bacteria. So instead of the actor killing the Bose, the Bose is the one doing the killing. So that's just what antimicrobial resistance is, very important. I think that it is something, it has become a public health concern. Right. I think that antimicrobial resistance has become a public health concern. So can you do you have any statistics to let us know how it might have impacted public health? Are there any statistics that, okay, WHO says that in this place, this is how we're struggling with,
Okay, so I think it was before COVID, 2019.
Okay. So
it was reported, because that was my concern when I began to really think about antimicrobial resistance.
Wow.
You hear words like superbugs, you hear words like, in fact, it's even categorized as a silent pandemic, right? Because I mean, it's a lot. So 2019, it was reported that we had over 10 million deaths.
10 million?
That's at 2019.
Wow.
Now, so pandemic happened 2020.
20 years.
If you look at the statistics, close to the deaths recorded for COVID. So you can imagine that we had something like that. But then COVID came because it was obvious. So AMR is not obvious.
Yes, it's not. Yes.
So people think that it's nothing to really worry about. But then COVID was obvious and it was just all over the place. So I would say that looking at the statistics and even down to what's happening now, it's been said that by 2050, right, if it's not curbed, if AMR is not curbed, we might begin to record, I think, over 50 million deaths. So
in 25 years, that's 25 years from this year, there's going to be almost 50 million deaths. That's almost a 100% increase in the number of people that are going to die from AMR. That's sad, and it is our wish that we will not be one of the number, but for us to not be a part of the number of this statistic, the job is on us to do what would prevent us from becoming part of the statistics. All right, so next question. What causes, we understand what antimicrobial resistance is now. We know the basic concept. So what is the cause? What makes this bacteria resistant to the antibiotics in the case of bacteria? What causes antimicrobial resistance?
Okay, so naturally they ought to be resistant. Like, I like using a very basic example, right? So let's say that you're friends with someone, right? And after a while, both of you become familiar with each other, and if you're not careful, over familiarity sets in.
See, finished.
Sets in. So it's a natural thing that ought to occur. But the challenge is that it has become more than it should be,
so much,
and that's why, and that's why the word superbug came up, I think around 2010. So let me now really explain what causes it. So for instance, a number of persons, they don't even think about the normal checks. Okay, let's really be sure that this was happening to our body system. We just decide to say, okay, I'm feeling this way right now, right? So it means that I would have to probably get a particular antibiotic. Yeah, so the normal thing that should be done is, of course, you visit the hospital and speak to the doctor, and they advise you on tests and all, which is like the basic thing. I understand that people have worries about that because of I know you're a med lab scientist, right? So is it 48 hours it takes, right?
72.
72. Oh, 72.
So the bacteria goes 72.
72. Yes. Okay. So because of that, the waiting time and all, people just feel that, okay, let's start something right? Before we begin to identify what
exactly
is the causative organism. But I would still say that even if that's the challenge, one of the reasons why the bacteria has become resistant is because we don't really check to be sure that this is what the cause is. Secondly, people have a whole lot of overuse and misuse of antibiotics.
Let's not go there.
It's no deal. Like, I mean, it's something that if we decide to talk just about that, it's broad. Overuse and misuse has been something that we don't really take into cognizance. Now, let me talk about misuse more. So misuse, a number of times when you begin to feel better, you just feel that, let me just stop. this particular antibiotic, right? And because of that, now, when you started taking it, it's beginning to take some effect in your body system. Then you decide to stop. At that point, you decide to stop. The bacteria organisms can now learn. So there's a process that happens at that time. They now learn a system that helps them resist what they are treated. So you even begin to feel worse. And that's how we started. You begin to feel worse than you even felt when you started treating it. So misuse, overuse, of course, substandard medicines.
Oh yes,
all
very
over
good.
the
Thank you. Let's touch on that.
I mean, it's something. So imagine we have antibiotics that do not have the required. I want to use the basic term ingredients. Imagine you're cooking and you don't use the basic ingredients, right? Salt. So imagine what would happen to your body system. So that's the same thing. If that particular medicine doesn't have the required ingredient of an antibiotic, of course it causes more harm to your body, and resistance could also occur. So these are some of the terms. I'm still going to mention an aspect when it comes to the veterinary field as well, of course, which is very, very important.
Yes.
So,
yes. Very good. Thank you so much, Dr. Praise. That was so enlightening. So we've learned, of course, we'd recap, but we've heard that antimicrobial resistance can be caused by what you do. All right. So now this one is not something that just happens to you. This is something that you bring on yourself. All right. So overuse of antibiotics, misuse. Those of us, including myself, because I'm one of the number. To give you medication, I mean, that was in the past, but let me just include myself. You give me medication, and when you see that you're starting to feel better, you stop taking the medication. It's very, very common with a lot of people, a lot of patients, and that's not advisable. Okay. Also, the purchase, like she mentioned, purchase and ingestion of substandard drugs. That one is another topic on its own. If we start there, we wouldn't be able to finish today. So now that we know what causes antimicrobial resistance, what's the effect? Somebody might be saying, okay, I'll overuse the drug, so what? I'm trying to help fight the bacteria very, very fast, What is the consequence? Is there anything that would happen to someone watching this now that say, I know they finished my dosage, or what can we tell this person? What's going to happen to them in the long run if they're not, if they eventually have bacteria or the microorganism in their body that the drugs are not fighting against?
Okay, so let me begin this way. So if we've talked about, of course, what the causes are and all, now what will now happen, right? If you don't pay close attention to all of this. So I would begin by the basic one, which is kind of extending from what we just talked about. So prolonged infection. Infection is one key. Like when you just speak to anybody, you just hear, oh, I'm experiencing this sort of infection and this. So when you don't possibly take the required dose or you don't pay close attention to what you're supposed to do, it can cause prolonged infection because, of course, the treatment wasn't completed, right? So instead of doing its work, it will now prolong what is actually occurring in your body. And imagine that infection spreading.
from one side to
from
another.
one side to the other. And that's why, of course, we have issues around sepsis today.
Yes.
I mean, that's prolonged. I had, like, I don't want to say I had a case, but then, as veterinary doctors, there are also cases like that. So we had a case like that, and it was really painful that it was as a result of sepsis. Of course, the patient ran into septic shock, and that was how we lost
the patient.
So it also occurs in humans, right? Yes. Humans, of course, animals, same thing, same procedure and all. So these are things that can actually occur. Other consequences that could also occur. In fact, let me now bring it. I think this will be the best time to talk about it. So when you look at the animal industry, just to mention a little bit, so most farms these days, because of course, they want to improve the growth of the animals, growth promoters and all of that, they give antibiotics, which is not advisable. But then we still find that happening in some cases, right? So when they do that, and of course, some sort of residues could still be left, and let's say those animals are now slaughtered, and we tend to consume the animals, we are indirectly consuming the same. So imagine we are consuming the resistant bacteria, and we begin to experience all of the effects and all. So the consequence in that regard, I know that some persons may not be able to dictate the meat that is fit for consumption and all of that. So I'm just saying that some of the consequences may be direct and indirect. Right? So in this case now, it could be an indirect consequence that could happen. I may not be immediate, so you begin to experience all of those stuff later. So of course, from prolonged infection, illness prolongates, then of course can lead to mortality. Not in all cases, but remember the number we gave, the statistics we gave
10 million.
About. So and I mean,
statistics that they are expecting.
And of course, that statistics is direct.
Not even indirect.
So
we are indirect.
So you can imagine what that would cause. So I'm trying to just be brief and focus on the one that matters most. So, but from prolonged infection, of course, illness occurs, and of course, it can also lead to death. So that's it, basically.
Wow, that's a lot, and it is very, very interesting that as deadly as AMR is, we don't. Not necessarily that we don't talk about it enough, but I feel like a lot of people are not enlightened about it as much as they should be. Okay, we hear about hepatitis B and hepatitis C, and these days a lot more on diabetes and hypertension, but we don't emphasize enough the harmful effects of antimicrobial resistance. And I'm learning a lot, I'm sure you are, but before we continue to learn, we're going to go on a very short break, and we'll be back. We still have Dr. Praise in the house with us, so we will continue to learn from her. Don't go anywhere. We'll see you very shortly. This is why we this TV was watching.
The Build Up Development Initiative has embarked on the project Build a Local Eco-Friendly Library. This is a climate innovative approach to supporting our children and young adults living with disabilities in our rural environments in Nigeria, starting with Benue State.
This is your father community where the Build a Local Eco-Friendly project will be going on in Makurdi, Benue State. So here's a view of how the land looks like, and I'll be taking you through a walk on how everything is going to go on. So let's take a walk together. Okay, so this is like the entire space that we will be working with. You can see the entire space of the land, and this is like a project that started. This is supposed to be like a security guard place for the community. But upon giving us access to this land, we're going to be utilizing this uncompleted building as the security post for the entire library and the project. So while the structure is going on, we're going to ensure that this is also going to get to completion. And one fascinating thing about this, 95.5% of children living with disabilities in this community are out of school. So you may begin to ask me, so why not take them to school? Why not see how they can return to school? So the challenge is they are being bullied in school, and we do not have trained teachers who understand how to handle them. So while we are doing this, we are trying to see that they get that access needed to them.
I am Sir Amanda Hemba Williams, the engineer handling this project at Jofada community, which has been initiated by Yield Up Development Initiative. The aim of this project is to aid people living with disabilities.
My name is Ubasi Simon. This is the Okada community. I'm the project supervisor representing Yield of Development Initiative.
That this project will be a great asset to the community. It will create a safe place for the kids to learn, grow, and connect with each other. It will also create a place where people can learn about the importance of sustainability and environmental protection. We need your help to make our dream come true. Kindly donate to our GoFundMe account today. Come closer. Let's go fund Project Build.
Emmanuella, and I have my guest here with me, Dr. Praise Akobo. And so far, we've been speaking on the topic superbugs, the hidden threat of antimicrobial resistance, and we've been able to define what antimicrobial resistance, also known as AMR. So in case I'm saying AMR as we are speaking, you already understand what we're talking about. We've been able to define it in basic terms. We've been able to identify the causes, and we've also been able to identify the consequences, all right? Because there is, in the healthcare world, there is almost no cause without a consequence, all right? So we've been able to discuss these three key areas, and then we're going ahead, all right? So just as a means of recapping, we've said that antimicrobial resistance happens when there is an infection, be it viral, bacterial, whatever, an infection by a microorganism in the body, and then the drug, which is supposed to be fighting against the microorganism, is not fighting, because now the actor has become the boss and the boss has become the actor. So in other words, the drugs, the bacteria is becoming very, very resistant to the drug, and nothing is happening, all right? We've also said that causes include overdose of drugs and misuse, and then we've also gone ahead to discuss consequences. So if you are not using your drugs correctly, you will be prolonging your infection, all right? So instead of the drug to be doing its work by fighting, you're just going to be making the infection stage to be longer, all right? And a very, very dire consequence of this is death. She also gave us statistics. As of 2019, she said 10 million people have passed from antimicrobial resistance, and there is an estimation of 50 more million people passing in the next 25 years. These numbers are very big and very scary, but don't be afraid. There is something that we can do to make sure that we cut the flow of antimicrobial resistance, we nip it in the bud. So Dr. Praise, what is being done right now? To every cause or to every problem, I believe that there is a solution. So we've discussed the problem, but at the solution stage, is there anything that is being done globally, maybe even in Nigeria or in other countries and in the world at large? Are there any measures being taken in place to make sure that we are curbing the flow of antimicrobial resistance?
Yeah, very well. So let me begin from the international level. So we have 3 organizations that has actually come together to provide some sort of solutions that so far it's been very much helpful. Of course, we have the WHO, World Health Organization, we have the FAO, and we have the World Animal Health Organization, right? So it's they had to form like a three organization together. They call it, is it tripartite, something like that. So,
yes.
Yeah, so they have really done quite a lot, and some of the things that they've spelled out and is still being done. The first one is focused on ensuring that we provide evidence-based surveillance and of course research, because surveillance sort of helps you identify what's the let's call it antibiotic resistant genes, and of course even the organisms. So you can actually bring, let's say, water, and you try to dictate what particular antibiotic, what particular antibacterial is resistant in this. So they are not just focusing on the aspect of the drugs. They know that food and all is very important for them to check all of those things. So I've seen a lot of work going on in that area, and I'm glad. I think it's something on an international level, on a national level, we can also work towards. So research is key. So in our institutions, we can really foster research, encourage people to look at the line. Remember we said it's a silent killer, it's a silent pandemic, right? So encourage people, speak to people, and of course that brings me to the second aspect, looking at awareness creation, education, educating people about the effects In fact, educating people about the prevention is very important. Why you tell them, why you tell them about the effects, better to first tell them about the prevention, what they can do to stop this. And of course, tell them what the consequences are. Because sometimes people want to understand how big this problem is before you see them acting, right? So if we have people, if we have frontliners who are there speaking about this on the international level, it will help. Of course, I know a number of persons have been doing that. Was it recently, late last year, there was an organization that had to, they had like a training program where 40 persons were selected from different parts of the country so they are serving as Superbug ambassadors.
Was that in Nigeria?
Yes, in Nigeria.
That's interesting.
So it was a Nigerian organization that did that, but then they had to get people from different parts of the world. And of course, I know about 3 persons who were part of the program, and I got feedbacks from them. So it's really something. I'm glad that people are doing so great work. Another thing that I see that can be done on a larger scale would also be sanitation. Wash water. It's very important, the hygiene, because I mean, bacteria, they easily multiply and spread when, of course, the environment is in a very poor condition. So that's something that we can enlighten people about. We can also see that from the perspective of institution, we ensure that environments are clean, we ensure that we have basic hand washing material. So I know that, of course, sanitizer is great, but ensure that if you're utilizing sanitizer, it should have at least 70%
alcohol.
So people don't really look at that, but then it's really better to use soap, like just soap and water, because it also helps remove germs and all. But then the sanitizer doesn't really have that effect as soap. So that aspect of hygiene is something you cannot overlook at all. I would have loved to talk about laws because I'm big on policies. But one thing about policies is that, of course, when the policies are there and it's not being implemented, it's a challenge. So I would also say that it's great to look at frameworks, policies that can also help foster work around AMR, but then not just bring up the policies, ensure we already have policies, but then ensure that the policies are implemented
and followed,
because it's the government and of course the bodies that will be able to help us regulate this. If we have that, people would want to really follow, because of course it's coming from the top, right? So I think these are the aspects I would just focus on from the institutional level.
Amazing. These are very, very, amazing ways that AMR is already being tackled. And now to bring it home to us, individual, one by one, the government is a body. I mean, while it is made up of individuals, it's a body, right? The organizations he mentioned are bodies. Now, one by one, as a person, as Emmanuella, as Praise, as Daniel, Ikechukwu, and every other person watching this right now, how can we, in our own comfort, in our own corner, do the little bit we can do to tackle AMR? Okay,
so I would have begun with hygiene.
Okay.
But just recall that there's an aspect people sort of they overlook a whole lot. We're still going to talk about the ensuring that you take antibiotics in the right. And please, as we're talking about antibiotics, doesn't mean that it's just antibiotics that is under the class of antimicrobials, right? Remember we talked about
antifungal, antiviral.
Exactly. So let's just really have that in mind. But then looking at this aspect now, waste management has been a challenge, and people don't understand that some of these antimicrobials can actually be lodged in waste.
Wow.
So how do we dispose waste? So for instance, waste from hospitals, waste from farms and all. Do we rightly dispose it? Do we recycle? What are the measures? Because in those wastes, you can have the antimicrobials, you can have resistant bacteria, you can also have the genes itself. I think I was reading something last year and I saw that part. I was like, wow, this is really...
the genes can be in the waste.
Can be in the waste as well. Crazy. And I mean, so all of these things I got to know because I read it, right? And someone had to put it out there. That's what we're talking about.
Research.
Right? Research. So I would say that some of these wastes, I'm referring to this both on an individual note and in an institutional note, maybe not the body as a government, but then we are working, we have people who work in the hospitals, we have people who work in the farms and all of that. Thank you. Imagine factories that produces antibiotics.
Very, very true, very true.
Yeah, so please let's really ensure that we take that part really serious and ensure that we manage the waste properly. A lot of persons have been talking about reusing waste, which is a good one, because of course when you reuse, the effect of, and you have to reuse appropriately.
Okay.
Yes. So understand how the reuse measure is done. You may not be able to talk about it today, but then there are like 5 hours when it comes to waste management.
5 hours.
5 hours. Recycle, reuse, repurpose, and all of that. Yes. So I know people talk about it when it comes to plastics more, but then there's an aspect of it that really focuses on this. But then probably we would have another time for that. Yeah. So another aspect is, of course, the basic one is when you're giving any form of antimicrobials, be it antibiotics and all, ensure you follow the dosage.
Hold your ear like this.
Ensure you follow the dosage. Ensure that you also go through the right route. Don't just go to because you're now comfortable. Someone was telling me that, see, praise, life is very easy when, you don't have to go spend. I was like, wow, you don't have to go spend. You already know that this is how you're feeling, right? So just go to the chemist and get.
Everybody's a pharmacist. Everybody's a doctor. Go ahead.
So please, all of that is not needed. Just ensure you go through the right procedure. I was excited when I saw that there's an AMR kit now.
Oh.
Yeah, I'm not so sure about Nigeria currently, right? But then I know that we have that in some other parts of the country. Yeah. But I want to believe that there's something like that here as well. So we have the kits that has reduced the time. So the 72 hours, that's
for
really,
the culture,
I think between 5 to 7 hours for the kits.
Oh, nice.
And it's able to actually differentiate between bacteria, fungi, and all of that. So the kits as well has really improved some of the measures and the solutions to see that we get faster results, and of course that will help us with improved treatment. So that's one thing again that I know that has really helped. But please take note of that. Ensure that you are an advocate of AMR. You don't have to be an advocate as probably those in the medical field and all of that. No, it's for everyone. Everybody. And I usually say this, if it affects a number of persons, it affects everyone.
Yes, it does.
It may not have affected you at the moment right now, but then if I ask a question, who hasn't taken antibiotics in the last, am I saying 5 years? 2 years?
2 years.
Who has not taken antibiotics? So there might be some things that you may not have noticed. I don't want to start talking about the body system and all, but then it's for everyone. So ensure that you're spreading the news, the information to everyone around you, and you're also amplifying this message, because if all of us can really share the message, across to people. Imagine people in underserved areas, they know nothing about this. People are not really going there to, and aside going there, they don't have improved what they call it, environmental condition. They also don't have some of the facilities that will really help amplify this. So we can also get our efforts as individuals towards them, while we still do ours. So I think on that part on an individual note, what we can do, and like this is something I think we can also do to support the process.
Amazing. Thank you so much, Dr. Praise. You've mentioned very, very important and interesting things to note, both at the global scale and at an individual scale. We've learned so much. I think one thing that really stands out for me is hygiene. You see how at the end of the day, hygiene somehow comes around to everything that we do. Hygiene is super important. Okay, so for those of us, I like including myself so you don't feel isolated. Those of us who go to the bathroom and don't wash our hands, who don't dispose of waste from household, from factories, hospitals, all of that, who don't dispose of waste properly, we are contributing to this silent killer, and that's not what we are here for. What we are here for is to fight against it, okay? So don't act like the resistant bacteria now. Fight against it, all right? So, Dr. Praise, to conclude, you mentioned how there are presently AMR kits, even if you're not sure if they've gotten here. So I think that's like a breakthrough, a future. Are there other things that are happening right now that are, advanced ways of helping to fight AMR, that are combating it presently?
Okay, so I am very sure of the kits, like I've mentioned already, but other ways that other aspects that I've seen that has been helping with combating is the surveillance that we've spoken about. Because when that is done, they are able to dictate what particular resistant bacteria is actually present. But other things that can be done, I was looking at what has been done over the years. I saw that I think the last time a new antibiotic was really produced was around 1987. That's like over 3 decades ago. Am I correct? Yeah. So you can imagine, it means that we've just focused on. We have 6 classes.
Yes.
Right? We just focused on the 6 classes, and we keep. I don't want to use the word reuse. But that particular. So I can't say what the restraint have been. Of course, we know what the obvious restraint can be around producing new drugs and all of that.
Yes.
But I think if we can have that breakthrough again, it could also support. It could serve as that groundbreaking stuff that can support the whole issues around AMR. So the fact that we've not had any new class of antibiotics is also a challenge. Another thing that in my undergraduate project, let me just briefly mention that I actually did something around AMR. Sort of, I was trying to find out the most commonly used antibiotics in a particular region. And I mean, if I mention it now, everyone would know. Tetracycline. No. I mean, that was for poultry farm, right? So of course, if it's humans, you should call that. So when we started the project, I was telling my friend that I know this is a research, but then I think I already know what the result will be at the end of the day, right? I was right. The first stream I had in mind was, what actually the results showed, right? So what I'm trying to say is there are other groundbreaking research people are really coming up with, like zero antibiotics from natural products, natural plants, and all of that. Yes, so I have a friend who has research interest in that area, and he's really working towards that right now. I think I wrote that in my recommendation anyway, but then I know that it's not something I am doing personally, but I've seen that people are doing that, and it's really producing results, right? So gradually, even if it does not probably come to the limelight fully, but then it's something that I feel that if we invest more in, it will also really boost the issues around AMR.
Very interesting. Thank you so much, Dr. Praise. This has been such an enlightening and educative session that we've had with you. So, dear viewers, we hope that we've been able to convince you and not confuse you as to why superbugs, aka these microbes that have become resistant to drugs, why it is very important that we collectively come together to combat it. All right, so we already know what antimicrobial resistance is. I hope that you always remember the skin cuts illustration that Dr. Praise gave, and I hope that you also remember the actor and the bows, so that you can explain it and understand it better. I hope that you remember that the cause: overuse, misuse. Please stop prescribing drugs for yourself. If you want to be a doctor, you can go down the path of studying medicine, a pharmacist. Please don't prescribe drugs for yourself. And if you do the right thing by going to a hospital to get a drug prescribed for you, finish your dose. I want you to hold your ears and tell yourself, I will finish my dosage, okay? So if you have a drug prescribed, please kindly ensure that you finish it. She had mentioned that there are also indirect causes of AMR. So I think this one will be to our farmers and to people who have poultry. Stop trying to grow your animals and your plants by force. Let them go through the natural stages, all right? We also mentioned the consequences, okay? And your infection will just be prolonged. Instead of trying to get better, you get more sick. And of course, the most dire consequence is death. We don't wish that on anybody, and we don't pray that that happens. But hey, all hope is not lost. All right, Dr. Praise has mentioned how there are already measures being taken globally to ensure that the rate of AMR is reduced. Okay, so there are bodies and organizations that are actively doing surveillance, going through research purposes, just so we can reduce the rate of antimicrobial resistance. And at your own level, you don't have to be part of the WHO. In your own little corner, you can do the right thing by washing your hands, by helping us finish your drugs when they give you the dosage so you don't spread it, and disposing of your waste properly. These are the little ways that you can contribute to ensuring that we reduce the rate of AMR. So all hope is not lost. There is already a future. She had mentioned a kit that would help us to identify those resistant bacteria. So all hope is definitely not lost, but we need you to also join hands to make sure that we are fighting effectively against antimicrobial resistance. This has been such an enlightening session. Thank you so much, Dr. Praise. We're happy to have you, and we hope that in future we would see you again on a bigger scale and talking about this thing. And we hope that when we're discussing it at this time, we will not just be mentioning the statistics of people that have died, but we'll be mentioning statistics of people that have been able to exactly been saved because of the researches that have gone on. And we hope that you will be part of that number. Thank you so much, our dear viewer. This has been the My Health and I Show. My name remains Emmanuella, and I look forward to seeing you next week. Thank you very much.
She is not just a psychologist, she is also a shoe maker. She was trained as a medical doctor, but now she makes beats too. He studied law, and now he is a fashion designer. This one has gotten a new skill: makeover. He came into this camp a biologist. Now he is also a caterer. Saeed, skill acquisition and entrepreneurship development, helps you discover a new lease of life. What are you still waiting for? Get up and acquire a new skill now.